Well, the hope of the crisis services system is to get individuals the help that they need when they need it or where they need it. And the other aspect of the Colorado crisis system is to provide law enforcement also customer service to get the support that they need. And in that way, law enforcement is back on duty.
We collaborated with fire and GPD, Greeley Police Department, because the importance of being able to offer a client exactly what they need in their moment is a part of what we all bring to the table.
What is a true emergency? Chest pain, shortness of breath, a stroke? Yes. Can a anxiety attack, can a mental health crisis be an emergency? You bet it can. But who is better equipped to fit that need? And that's where crisis comes into place.
We know the individuals in Crisis Center. We know some of their disciplines. We know what they do, what their goals are. And so we obviously would inform our communications, dispatch or something, if we had that individual in crisis, hey, we're gonna be coming. And pretty often they're gonna greet us out there, or they're gonna be expecting us, and that's huge. So we're able to talk to them, brief them on what we have, and not a lot unless they need us to be briefed more, and then obviously leave it to the professionals for them to help.
So when there's the initial contact, if let's say a police officer brings somebody in, that initial contact is like, we're hearing from the police officer kind of what's going on, and we're also trying to make sure we're hearing from that person of what's going on.
And once they realize that they're safe, a lot of that fear disappears, and they can work on fixing that self-doubt, work on getting stronger, opening up.
Crisis looks different from person to person, so what our job is to try to figure out how we can help at that person's level.
In respite, when someone is in crisis, we can provide them with a place to stay for 2 to 14 days, depending on their treatment plan and how they are working towards their goals.
We offer life skills, we offer resources.
Outpatient therapies, intensive outpatient therapies, resources for things like the residential treatments.
Any treatment that can help them towards their recovery, we can provide transportation for, providing them with hope.
We're getting them what they need. It's not just a business, it's really that we care about them.
We trust the Crisis Center, we trust the people in the Crisis Center, and we've seen successes.
So to further support law enforcement first responders, we have an 800 number that's statewide that they can, and any first responder law enforcement can call. But for North Range Behavioral Health and Weld County, we have an 800 number that is local and staffed 24/7 to provide over-the-phone triage if you have questions or concerns about someone you're meeting with that may be in a crisis of some sort. So our hope is to continue to grow relationships and establish new relationships that will benefit our community as a whole with crisis and the needs that occur.